So let's now look at the risks of using drugs. And let's take a look at marijuana first, because that's a drug of uppermost concern. As Minister Teo said, it is the one for which perception of harm is the least. It is the one for which young people feel the most comfortable trying, because they have heard and they have read and they have listened to messages that say it is only a plant. So I ask you in the audience again, if we have a brave volunteer, how many plant species exist on this earth? Anybody want to guess? How about over 300,000? Anybody want to guess how many are safe for eating? About 300 to 500. A tiny fraction. Why? When you say it's a natural, it's only a plant, why is it that so many plants are poisonous? Well, plants don't have teeth. They don't have fangs. They don't have arms. They don't have legs to run away. They have no protection. The only protection they have are chemical protection. They make chemicals. They make chemicals that interfere with the nervous system of things that will eat them, like insects, like mammals, like frogs. Now, some of these chemicals we're very familiar with. Nicotine resembles our own chemical message. The tobacco plant, if you have enough nicotine, will kill you. Somebody did an experiment at the Mass General. He exposed a tomato leaf to cocaine, and he had new larvae come and try to eat that leaf, and the larva died because cocaine resembles the chemical messages in our brain. Almost all the drugs that are psychoactive come from plants. But the plants make them to protect themselves from us, from animals that eat them. So to say that it's natural is a fallacy for a very obvious reason. Let's look at some of the consequences of marijuana. So there are 5 categories that are really important. What happens at the level of the cell, brain structure, addiction and mental health, behavior and function, long-term, and also will include the developing fetus. What are some of the consequences? Minister Teo referred to many of them, and I feel I'm repeating what her wisdom was shared with you today. But I'm going to present the scientific data that underpins what she said, which was highly accurate and informative. We have to remember that, first of all and foremost, THC is no longer the 3% in marijuana that we thought of, that people used in the 1960s. Right now, the levels of THC, which is the most critical piece, the most critical chemical in marijuana, is anywhere from 20 to 90%. What that does is gives you a greater high, it's more tolerance, more addiction, more users, and of course, more profits. THC is no longer a natural plant. It's been bred and strained and purified, converted to facsimiles of chocolate bars. The high-potency THC is associated with higher risk for psychosis. It lowers the age of developing schizophrenia. The high potency is associated with impaired memory, brain function, impaired driving, emergency care. It's associated with the use of higher drugs. More use, higher risk for progression to addiction. So I'm going to take a very deep dive, a quick dive, into marijuana and self-biology. And And for those who know what transcriptomics and proteomics do, I congratulate you. For those who don't, please bear with me in terms of what we learned. So we subjected preclinically animals to daily THC, which is what's happening now in the US. More teens now are using marijuana daily than ever before at a moderate dose. And we said, which brain region should we look at? Well, let's look at the emotional region of the brain, the amygdala that I mentioned earlier, because it's a very critical part of brain function. It contributes to Darwinian survival, but it's also important in terms of its high cannabinoid signaling. It's sensitive to marijuana. It's implicated in heavy cannabis use. It's implicated in promoting depression, anxiety, hypersensitivity, impaired facial recognition, and compromised cognition. And we did a study, and we found with proteomics and transcriptomics that there was a marker for inflammation that popped up in animals treated daily with THC. We were shocked. The data were so robust, they were so definitive, that I said, I can't accept this. So this was done at the University of Toronto with my good collaborator, Dr. Susan George, and we showed that this marker for inflammation is much higher than in untreated animals. And then in my own lab with Dr. Sarah Withy, we repeated it. And finally, I went to MIT with Dr. 𝗦𝘂𝗯𝘁cie__, and I said, Miriam, let's try this in your lab to make sure that I'm right, because this is really, really a strange and very concerning finding. And sure enough, all three labs found the same. But interestingly, it only happened in adolescent brain, not in adult brain. And what are the implications of that? Only in adolescent brain did we find this increase in a marker for inflammation. It increases inflammatory cells in this emotional region. These cells are implicated in brain development, inflammation, toxicity, sleep, thinking, depression, anxiety. Are these changes a new form of toxicity which may persist into adulthood? The paper's under review now, so please don't quote me. Keep it in this room. Marisa Silveira at McLean Hospital did a review of all the imaging studies done in adolescent brain and found that 46 studies of these 40, they found that there were a lot of changes related to marijuana in the adolescent brain, and some were associated with impaired function. This is a study that we did with Bob DuPont and with people at the National Institute on Drug Abuse, showing that if an adolescent uses marijuana, they're about 10 times more likely to smoke. They're about 10 times more likely to binge on alcohol. They're much more likely to use heavy alcohol, and they're much more likely to use illicit drugs like opiates. Adolescents are much greater risk for developing a cannabis use disorder, much greater risk. So if an adolescent begins, and these are 12 to 17-year-olds, if they begin using marijuana and continue to, within 4 years, 20% will develop a cannabis use disorder. For a young adult, it's only half of that rate. They are much more susceptible. The risk of using other drugs and developing addiction to other drugs for adolescents who have cannabis use disorder is higher with regard to nicotine, alcohol, cocaine, and stimulants such as methamphetamine. 𝗦𝘂𝗯𝘁cie__, a young man who's now in university, He did this remarkable study looking at national data, and he showed that the risk of developing an addiction to opioids, we'll call it opioid use disorder, the highest risk for developing an opioid use disorder is the use of marijuana before the age of 18. It's much higher than almost every other confound or covariate that he looked at. We're still on number 3, which is what are the consequences to mental health. Now, psychosis and schizophrenia could be one of the most devastating diseases that a person can have, because it involves an abnormal level of suspiciousness, bizarre thoughts and delusions, fragmented thoughts and disordered thoughts, hallucinations in terms of seeing, hearing, and feeling. And those thoughts can be transient, or they can disappear, or they can be permanent and have to be treated for a lifetime. And Marta DeForti, the University of London in England, she examined 3 cities, actually 11, London, Amsterdam, and Paris, found the more frequently a person uses marijuana and the more potent the marijuana, the much greater the risk for a psychotic disorder. And her potency was simply a cutoff of 10%. We're now talking 20%. A study from Denmark showed again that if a person has a cannabis use disorder, there's a much stronger propensity to develop a schizophrenia. And the propensity is very high among 16 to 20-year-olds for males and decreases over time if they're exposed later on. But for females, it increases over time. And it could account for a very significant number of people with schizophrenia. The same is true in Ontario, Canada. They found that the percent of people with cannabis use disorder that were associated with schizophrenia tripled after legalization. And that tripled for 14 to 18-year-olds, 19 to 24-year-olds, and 25 to 35-year-olds. There's also in the US studies showing that the rising psychotic disorders are associated with marijuana use. The risks are from high to low, a use disorder, frequent use, any use versus no use. And the more an individual quits, the decreasing risk of developing psychotic disorders. So when you stop use, the risk decreases. And I will persist again, because this is so important to emphasize. Early adolescent marijuana use is associated with young adult psychosis. Young adolescents are much more prone to develop it than if they're exposed. They're also more prone to develop suicidal thoughts and suicidal behavior. Now we move on to category 4, which is psychosocial function. This study was a beautiful one that compared cannabis use disorder, or disordered use, with just casual use or non-use, and showed that as use frequency increased, as the severity of use increased, there was more depressive disorders, episodes, more suicidal thoughts, more slow thoughts, more difficulty concentrating, more truancy, lower GPA, more arrests, more fighting, and so on. And this was one of the most remarkable meta-analysis I've seen. They looked at 63 studies in the literature of close to 500,000 young people, and showed that adolescents who use marijuana, what is the relationship to academic achievement? They're more likely to be absent from school, They're more likely to drop out. They're more likely to be unemployed. They're less likely to enroll in university. They're less likely to get a post-secondary degree. They're less likely to get good school grades or to complete high school. And the younger they start to use, the more they use, the risks are greater. Everyone is familiar with Madeline Meyer's study that showed that there's a drop of 8 points in IQ, and IQ predicts access to university education. It predicts lifelong total income and access to a good job and performance. And she found that persistent cannabis use started during adolescence. The children had less skilled jobs than their parents. They had poor memory and attention, and they could not explain it by confounds. In the workplace, absenteeism is correlated with cannabis use disorder and skipped work. And absenteeism in the workplace is correlated with days of cannabis use, whether they're complaints or injuries or illness, or they just don't show up to work. What about long-term effects? If a child uses during adolescence, what are the possibilities that this is going to persist long into adulthood? There's a whole host of things that happen that have been shown. There are much greater odds of using other drugs, to be high-risk alcohol drinker, to smoke daily, to not have good relationships. All their life outcomes are poor if they began to use cannabis during adolescence and continue. And this, once again, I'll perseverate, but adverse outcomes in adults with no pre-existing medical or psychiatric disorder, there's a whole host of them, that if they start young, they're going to have poor mental health outcomes, and frequency of use, age they start, and potency is critical. So to summarize, the adolescent marijuana user is susceptible to brain changes, to addiction, to deficits in cognition, to amotivation, to psychiatric symptoms, to functional problems and safety and health problems. And there's so many organ systems that are affected. Why? Because the cannabinoid system is everywhere. It's in your brain, it's in your lungs, it's in your heart, it's in your reproductive system, it's in your gastrointestinal tract, it's in your endocrine system, so everything can be affected. And of course, a developing fetus can also be affected because the cannabinoids are so critical. The ones that your brain produces are so critical in developing the fetal brain. And fetal exposure, again, gives rise to brain changes. It gives rise to preterm deliveries, small heads, low birth weight, and more admissions into the neonatal intensive care units. They have functional deficits in attention, thinking, social problems, psychosis, proneness, and sleep. Not a good picture for marijuana. It is not safe. It is thought that current marijuana users in the US, about 25 to 30% have a cannabis use disorder. And the most intriguing thing, which nobody who recommends it at so-called medical dispensaries ever tells you, is that the rate of cannabis use disorder is the same whether it's used medically or recreationally. It is between 25 and 30%. Methamphetamine is plaguing Singapore. It's not as prevalent, although it's rising, use is rising, and combinations of it with fentanyl are increasing in the US. But the production of methamphetamine can be very, very problematic. They use anhydrous ammonia, phosphorus from matches, lithium. Nothing is clean in its production. And it can be smoked or sniffed or stored or swallowed or snorted. It has very positive effects as well as very negative effects. It can produce aggression, talkativeness, restlessness, violence. A person can crash. It can produce psychotic symptoms, addiction, depression, and so on. Methamphetamine is just an awful drug. The overdose can produce arrhythmias, extreme hyperthermia, biphasic changes in blood pressure, hyperbreathing, muscle pain, coma, and death. And the consequences are behavioral, psychiatric, and vascular. And those consequences are quite real and quite prominent in heavy methamphetamine users. I won't go into each one of them, but it can produce cognitive impairment, anxiety, depression, violent behavior, insomnia, repetitive movements, and psychosis. And all three, psychosis, suicide, violence, are increased in amphetamine use disorder. These are global data. It can produce brain toxicity, which can decrease with increasing abstinence. But what is so interesting is we did this study in my lab a number of years ago in which we exposed young animals to methamphetamine and adult animals, and we found that the methamphetamine in the young animals destroyed dopamine neurons in the brain at a much greater rate than it did the adult. So the adolescent dopamine neurons were more susceptible than the adult to toxicity of methamphetamine. What does that mean for humans? Well, methamphetamine use is associated with Parkinson's disease. It's rare, but there's an increased risk for the disease. And what is so interesting is that Parkinson's disease is characterized by a loss of dopamine neurons. The circle comes full. It's greater, Parkinson's disease prevalence is greater in meth users and greater in people who previously used it. And methamphetamine affects, again, multiple organ systems because the natural chemical messages that methamphetamine targets, those signaling systems occur all over the body. Dopamine, norepinephrine. So you can have kidney damage, stomach damage, heart damage, tooth damage, skin damage. As to opioids, we all know. There's no need to go into the data. Severely addictive drug causes overdose, brain damage, death, infections, infective diseases. And in the United States, 14 to 18-year-old death rates are rising due to fentanyl. And that's because people are passing fake pills around, and these fake pills are laced with fentanyl. And a number of young kids don't even know they're taking poisons from friends, and they're dying instantly. A very excellent neuroscientist working in an excellent university sent her beloved, brilliant young son off to college about a year ago. And he had never touched a drug in his life. But he was very anxious the night before a stressful event at college. And one of his dorm mates said, "Oh, take this pill, it's a tranquilizer." And he was found dead in his dorm from that pill. And she weeps daily. And her husband, who's a psychiatrist, weeps daily. So what are we going to do